It's another day with the physicians where your health is our business.
The growth spurt will end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar. And I don't know about any other one, but what is low?
You're welcome back to the training also on your regular program. The term heart failure can be frightening. It doesn't mean that the heart has failed or stopped working. It means the heart works less efficiently than normal due to various reasons. Heart failure is a chronic, progressive condition in which the heart muscle is unable to pump enough blood to meet the body's needs for blood and oxygen. Basically, the heart can't keep up with its workload. What are the possible risk factors, the causes, the warning signs, the management, and of course the possible complications of heart failure? These and more are what our guests will be delivering on today's episode of your regular program, The Physicians. Stay tuned. It's another day with The Physicians where your health is our business. Today we'll be talking about heart failure. Anything that has to do with the heart is actually very frightening. What is heart failure? What are the possible complications, the symptoms, the diagnosis, and of course the risk factors? My name is Dr. Martina Agbemi. As usual, I'm not alone on this program. I have with me my regular
I remember Dr. Memuna Yusuf Kadri, and it's always a pleasure to be in your screen. Don't forget, we are the physicians. Your health is always our business.
It's always very exciting when you are. I remember that I need to just give those watching very important health tips.
Yeah,
I love the physicians, really. So we're talking about heart failure. Anything that has to do with the heart is frightening. Heart attack, heart failure, heart this, heart that. But then
we now have two combinations.
Yes,
of two things that are frightening.
The heart that is failing.
So you can imagine how that sounds when someone says, I think I'm having a heart attack.
Yeah.
So I'm happy that we have an expert that will help us look into it, because sometimes you find that the cardiologist will say, no, you need to see a psychiatrist.
Yeah, I'm actually very excited because the guest we have today is firebrand. We don't have enough time, so let's just ensure we just bring him in ASAP.
Because we need this. Words of wisdom is experience, and it's always a good guest when it comes in here.
Yeah,
we learn a lot.
So just take your paper and the biro and listen. Don't go away. We'll be back after the short break. Stay tuned. Welcome back. If you are just joining us, you are on to your regular TV health talk show, The Physicians, where your health is our business. Today we're talking about heart failure, the risk factors, the symptoms, diagnosis, possible complication, and of course management. With me in the studio we have a consultant cardiologist, the MD, CEO of United Heart Hospitals here in Lagos. You're welcome, Dr. Eugene Nwosu. You're welcome to our program, The Physician.
Thank you for having me.
You're welcome. It's always a pleasure having you here on the show.
Thank you.
So we're talking about heart failure. You know, when you hear the word heart failure, it's actually very frightening. So maybe you should make it not less frightening for people. So what is heart failure?
Okay, before we go into heart failure, let us understand how the normal heart functions.
Before you start
And
feeling.
then you can now understand the abnormality of the heart.
See, and I was just going to ask, give us an overview.
Absolutely.
Okay.
First of all, the heart is always working for you. Even when you are resting, your heart is beating 24/7. When your heart stops beating, you are dead. And the heart, normal structure of the heart is made up of 4 chambers. The upper chamber, which is the smaller one, is called the atrium. The right atrium and the left atrium. And the bottom one, which is the main pumping chamber, the right ventricle and the left ventricle. Blood that is given up its oxygen is returning to the heart, to the lungs to get more oxygen, enters through the right atrium, and it goes into the left ventricle that pumps it to the lungs.
Okay.
At the lungs, it gives away carbon dioxide and picks up oxygen. Oxygen-rich blood. It flows back into the left atrium, through here into the left ventricle, and the left ventricle pumps it to the circulation.
Okay.
And is carrying oxygen and nutrients to different organs. And it has to, the function, there should be a coordination between the upper smaller chamber and the bottom chamber. For example, it's a sequence. Blood contrasts from the upper small chamber, boom, into the lower big, and that one contrasts. So boom, 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 boom.
So
that is normal function.
Synchronized, yeah.
So if there is irregularity that disturbs that sequence, is going to cause a problem. That irregularity can come from the upper chamber, or it can come from the lower chamber. For example, a condition called atrial fibrillation, where this upper chamber is just quivering, is going to affect the function of the heart. Also, this upper chamber might be okay, but the ventricle has a frequent skip, what we call PVCs. That frequent skip can also affect the function of the heart. So, for the heart to function properly, you must have that. And also, this pumping chamber, the heart muscles, should be in good shape, because if they are weak and not pumping, it's going to affect it. So this is the basic circulation. So what is heart failure? Heart failure is the inability of the heart to meet the demands or needs of the body. So the heart needs to pump enough blood to satisfy the demand of the body. So when that is not happening, you develop heart failure.
Very simple.
So that's it. The heart is not functioning as normal as it should. It doesn't mean it's dead. Okay. The heart function is there, but it's weak. It cannot meet your demands. For example, you may have a heart failure, and heart failure has different stages. So you may have advanced heart failure, that when you are actually sitting down, you are okay. Because when you are sitting down, the heart is meeting the demands of the body. But when you now start moving or exercising, your body needs more in order to carry it, but your heart is not meeting the demands. So your heart failure might show up when you start exercising, but at rest, you are okay.
So would that not take us to the types of heart failure? Is that where you're going?
Sure. Well, there are different types of heart failure, and we can cover this. For example, the types of heart failure can also depend on what is wrong with the heart. For example, if there is a damage to your valve, the valves are not working, and this, you can have valvular heart failure. If your heart is, the heart muscle is damaged from viral infection, like COVID-19 can
Not
cover.
again, COVID.
COVID-19 can damage your heart muscle. Okay,
True.
what you have, myocarditis, inflammation of the heart muscle. So where your heart muscle becomes weak, it can also cause heart failure. If you bleed a lot and you don't have enough oxygen, remember, you don't have enough blood to carry the oxygen. Remember, blood carries the oxygen. So if you are severely anemic, that can also result to heart failure, even though the structures of the heart is fine. A good example is, sickle cell disease. People with sickle cell and they're severely anemic, and their hemoglobin is down to 5 grams, they will have heart failure. Okay, so, and if you also have poison, like people that drink too much alcohol, the alcohol will damage the heart muscle, you will also have heart failure. So heart failure can also be defined from what is causing it. But generally speaking, heart failure can be left-sided heart failure and right-sided heart failure. So remember, if it's coming from the left side, there are 2 types of left-sided heart failure. Heart failure with decreased ejection fraction. We're going to talk about what is ejection fraction, because you need ejection fraction to define heart failure and know how to treat it. So heart failure with decreased ejection fraction is a type of heart failure.
Wow.
Then there is heart failure with normal ejection fraction. So when you have heart failure, because when we finish today and you have a diagnosis of heart failure, you'll be asking your doctor, what is my ejection fraction?
Yeah.
Because that is going to define the type of treatment you have. So that's that. Now on the right side, you can also have right-sided heart failure. Generally speaking, if you have left heart failure, that left heart failure will actually be transmitted to the right, so that if you don't get treatment, the left heart failure will now cause right heart failure.
Wow.
That is the commonest cause of right heart failure. However, you may not have problem with the left, but you have lung disease. People that have advanced emphysema or COPD
of the
lungs, then it can make your right side fail. People that have severe pulmonary embolism, they have developed blood clot in the legs and the lodges in the pulmonary arteries, the arteries in the lungs, and they raise the pressure so high that the right ventricle cannot cope. That can also result in right-sided heart failure. So generally speaking, right-sided failure comes from disease of the lungs, but left can also transmit to the right. Okay.
So the main challenge is actually on the left side.
The left side, all of them are important, but the commonest is
on
the
the
left heart failure. Now, let's talk about ejection fraction.
Yes, please.
Ejection fraction is the amount of blood, the percentage of blood that you push into the circulation from the into the circulation. That is in other words, if this is before contraction, if this is the size of the left ventricle and it contracts, it pushes blood out. So the amount of blood it pushed out divided by the volume at the beginning of contraction is ejection fraction. When that ejection fraction is less than 40%, that is defined as heart failure with decreased ejection fraction.
Less than 40%.
Yes. Now, if the ejection fraction is 50% or higher, that is heart failure with normal ejection fraction. The difference is night and day, and the treatment is night and day. Between 40 to 50 is borderline. Okay, normal ejection fraction is 50 to 75%. Okay, so what are the causes of heart failure with decreased ejection fraction? In Nigeria, high blood pressure. Okay, now It can also be diabetes, because uncontrolled diabetes can damage and weaken your heart muscle, and your heart muscle is not pumping right.
Yeah.
Okay. It could also be like people that have a murmur over the years. They didn't pay attention. They did not see their cardiologist, and then the murmur goes real bad, and the heart gets big and fail. That can also cause it. So there are different causes of heart failure. People that suffered heart attack, okay, heart attack, myocardial infarction, over time develop heart failure, and it's usually heart failure with decreased ejection fraction.
So these ones are the ones common to us as Nigerians.
Yes, the one common to us as Nigeria is hypertension and uncontrolled diabetes. But there are people with rheumatic fever that have damage to their valves. Okay, they can also have heart failure. Okay. Now, the other reason for heart failure that people are not aware of is that if your heart rate is too fast, tachycardia, tachycardia over time will decrease the strength of your heart contraction, and that can also cause heart failure. Okay. There is one thing I want to cover quickly so that we can separate the two. The other one is heart failure with normal ejection fraction. It's people that their heart is actually strong and sometimes too strong.
Dr. Wilson.
What happens?
I'm listening. People with what?
That their heart is strong. And sometimes even...
Yes.
There are some athletes?
Not necessarily athletes. Okay. What I'm trying to talk about is that heart failure with normal function. Okay.
So healthy heart.
Healthy heart.
Quote unquote healthy heart. So what we are talking about is their heart function is good, but their heart is too stiff. So because when the heart is trying to receive blood, normal heart should relax, expand so that more blood can push in. Your heart might be working fine, but trying to receive blood is stiff. It doesn't relax.
Dr. Nwosu.
So that would be normal ejection fraction, but the volume of blood pushed out is low. Okay. Wow. And the number one reason for that is high blood pressure.
High blood level.
Yes.
Please just hold it there. When we come back, we'll tell us the reasons why a heart would decide to be stiff when it's normal. Yes.
Yeah, because what is making...
Yes, when we come back, you will expatiate more on that one. It's getting very interesting. Don't go away, just stay tuned.
It's when you have problem with your heart, you have difficulty in breathing.
When the heart stops working suddenly.
Heart failure is a disease of the heart, which even the person that has that problem might not even notice.
Heart failure can be caused by different things like the kind of food and some medical ailments.
There are many things that can cause heart failure. Number one, when you don't eat right, when you eat too much of junk foods.
It might be as a result of, one deformity or the other in your system. It might be as a result of lifestyle.
The difference is cardiac arrest happens suddenly, while heart failure can take years before even the person that has it notice it.
I think cardiac arrest now will be in terms of the suddenness of that thing. It will come like, it will be unexpected. It's something that will come as a shock. It's that suddenness that make it to be a cardiac arrest, where your breathing can just stop unexpectedly.
Cardiac arrest happens suddenly, while heart failure comes with symptoms, because heart failure comes with I think it comes with complications, health complications.
Welcome back. If you are just joining us, you're on to your regular program, The Physicians, where your health is our business. Well, actually, we've been talking about heart failure, and our guest here, Dr. Eugene Nwosu, has been doing justice to just that. And he's told us a whole lot about the heart failure, the causes, and he did talk about the normal heart that can be stiff, and that causes a problem. Please, do you want to expatiate more on that? Okay. Why will a normal heart decide to be stiff?
Okay. The basic fact is that, let's take high blood pressure for example. When you have high blood pressure, each contraction, the heart needs to generate enough force to push blood into the circulation. Get it? Now, remember, heart is a muscle. Just like when you go to the gym and you start lifting weights and doing presses, over time you start having big muscles. Okay? Okay. All right. So having big. So when the heart is seeing a lot of blood pressure, it starts thickening up. Okay. So look at it this way: if your blood pressure is 120/80, your left ventricle needs to generate enough force to overcome that, to push it. If your blood pressure is 180/110, more. So that action over time will make it now getting thick. And when it's getting thick, it's decreasing the volume that will receive blood to pump out. So, and because it's getting thick, when it's about to receive blood, it doesn't relax easily. So it's kind of stiff. And that will make it receive less blood to push out. But if it relaxes more, it gets more volume and it pushes out more. So the first effect of high blood pressure on heart failure is actually heart failure with normal ejection fraction. Okay. Then over time, your heart will now start getting big, and finally it gets weak, that the pumping action decreases. That's when it becomes heart failure with decreased ejection fraction. So if I see you early in this process and you have heart failure with normal ejection, the treatment is different from when I see you when you have heart failure with decreased ejection fraction.
It means that the heart muscle is enlarged.
And that is why, to treat high blood pressure, you must do test that will tell you what the ejection fraction is.
So, but before we even go into that, what are the risk factors?
Okay, fantastic. Now, the risk factors for high blood pressure, for heart failure in this part of the world is, guess what? Hypertension. Hypertension is number 1, number 2, number 3, number 4.
Whoa.
It's so common. Then the next one will be diabetes. When you have diabetes that is untreated, your blood sugar is always high, your hemoglobin A1C, which is a measure of your average blood sugar control in the last 3 months, is very high. Those things are damaging and weakening your heart muscle, and at some point your heart is big and very weak. So diabetes will cause diabetic cardiomyopathy. That is weak heart muscle, heart failure. Okay. If you have irregular heartbeat, whether it is atrial fibrillation from
the smaller
chamber and all those things, we give you that. Okay. If you have irregular heartbeat coming from the ventricles, what we call the PVC, premature ventricular contractions, over time will also decrease your heart muscle. It's also a known cause of heart failure. If you have hyperthyroidism, people develop hyperthyroid, they come and they are having palpitation and fluttering. That rapid heartbeat, even though it's not chaotic, over time will also result in heart failure. So there is tachycardia-induced heart failure. Any form of tachycardia can do that. So if you like to drink, in Nigeria we drink too much, and alcohol is a toxin, so people don't realize it. So that toxin can damage your heart muscle, and then you have heart failure. And alcohol also can cause atrial fibrillation, irregular heartbeat. So even if your heart muscle is not damaged and you develop atrial fibrillation, you can lead to heart failure. Okay, so the other things, like, you have, even before COVID, some of the patients develop viral infection, and that virus will settle in their heart and damage their heart muscle. You have what we call myocarditis, inflammation of the muscles of the heart. That will also cause it. And with this COVID also, COVID can cause COVID-19 cardiomyopathy. So any of those things, you can go down and down and down. The list is endless. And then, of course, in Nigeria, people with rheumatic fever, they damage their heart. There are some elderly people with a valve problem, like aortic valve or mitral insufficiency, that can cause that. And in America and developed countries, the number one cause of heart failure is actually coronary artery disease, heart attack.
So it's always a delight having you as a guest. Time is never enough. Well, thank you so much for enlightening us. I'm sure our viewers out there actually have gained a whole lot, like we do here in the studio. Well, another time we'll still call on you to come and break down some of these things. Thank you so much, and we enjoy your topic. We always enjoy it when you speak with us. And my viewers out there, I'm sure you heard it from the consultant himself here. Well, time is never enough. My name is Dr. Martina Agbere. Ensure you always keep it date with the physicians.
Thank you very much. It has been a blessing. Why am I saying it's a blessing? For the fact that when you hear the word heart failure, it's more like a death sentence, but it's in your hands, viewers. Till next time, I remain Dr. Memuna Yusuf Kadri, and please don't forget to follow us on all our various social media platforms. If you want to be here, you're just a click away. Just let us know, and you'll be invited to be our guest in the studio. God bless you.
I'm Dr. Lera Roberts. I'm the second Vice Chairman of the Association of Public Health Physicians of Nigeria, Lagos branch. Please do not play with your life. It is so imperative that you do the right thing. You must keep watching the physicians for more information.
If there is irregularity that disturbs that sequence, it's going to cause a problem. That irregularity can come from the upper chamber, or it can come from the lower chamber. For example, a condition called atrial fibrillation, where this upper chamber is just quivering, is going to